Extremely Wicked, Shockingly Evil and Vile, produced by Joe Berlinger, and clinical analysis by Nevaeh Morales. Theodore Robert Bundy. The main character that we follow in this movie is Ted Bundy. He is one of the most notorious serial killers of the U.S. His killings began in the mid-1970s and started in Washington. Ted Bundy traveled across multiple state lines where he would go to their local universities and find vulnerable women to lure and kill for his own pleasure. One of Ted's most notorious characteristics was how charming and normal he seemed to be, which made everyone overlook the suspicious things he was doing. The film depicts Ted's life a few years before he committed his crimes in Seattle, Washington. Throughout the film, Ted is continuously being accused of the crimes he has committed, but Ted spends the entirety of the movie fighting for his innocence and trying to convince the jury and public that he is not the man who committed these crimes. Ted's diagnosis. After close analysis of the film and Ted's actions, I would diagnose Ted with ASPD, which is short for Antisocial Personality Disorder. Individuals who are diagnosed with ASPD typically disregard the rights of others and overall lack empathy/remorse. They tend to manipulate others and lie to hurt everyone around them or use them for the benefit of themselves. People with ASPD are also commonly referred to as psychopaths. In the film's cultural context, it was unusual for people, especially men, to go and see a therapist for treatment or diagnosis for their conditions. This is why Ted never received the treatment that might have been able to reduce his urges. In a broader sense, ASPD can affect individuals in any culture. ASPD is a personality disorder, so no matter what culture you are a part of, if you are in an environment or have the genetics that can cause the development of ASPD, then that individual will display those symptoms. The most common stigmas behind people with ASPD are typically narcissists, murderers, and apaths. Ted's displayed symptoms. Throughout the movie, as Ted tries to convince everyone he is innocent, is a main indicator he has ASPD. A typical psychopath will manipulate every situation so that it can go in that individual's favor. Although Theodore did commit the murders, he still proceeds to manipulate thousands of people, media-wide, into being on his side. Before it is revealed at the end that he did commit the murders, you can see he feels entitled to special treatments and has an inflated ego. This analysis explains why Bundy was so adamant that he would get away with his crimes, especially when he decided to be his own lawyer in court. Another symptom displayed is shown at the very end when Bundy admits to Liz that he was the one who committed the murders. The film then cuts to scenes specific to each crime. These cutscenes show how Ted can go from being charming and sweet, but then switch over to this monster that can harm people with no sort of guilt whatsoever, which is a main characteristic in ASPD. One symptom of ASPD that Ted did not display would be a disregard for normal societal behavior. Although Ted was committing heinous acts, he was still composed as a normal man in society during that period of time. Treatment. My proposed treatment plan for Ted would be a mixture of biological therapies, medications, behavioral therapy, and social skills training. Treating ASPD has been deemed somewhat impossible due to their constant urge to manipulating their therapists than in changing themselves. This is why I believe medicating people with ASPD might be able to calm these urges and allow the therapist to try and attempt to provide the patient with some help on how to control their actions and thoughts. The only ethical concerns that I can see with this form of treatment would be the fact that some people do not always agree with the use of biological treatments on patients. Although it is posed as a concern, it might be a critical part in minimizing the harm these individuals can cause. The societal barriers that are shown in this film is that men during the 70s usually were not supposed to receive therapy/mental treatment, as it was seen more as a womanly thing to do. It was deemed socially unacceptable for men to struggle with their mental health, which could be a main component on why Ted never tried seeking help. ASPD portrayal. In my opinion, I feel this movie did an okay job at displaying ASPD. We do see a lot of characteristics an individual with this condition would display, but it would have been more insightful if we had a more personal perspective/in-mind experience of Ted's thoughts as he was committing these crimes or trying to manipulate the media into thinking he was actually innocent. The portrayals of disorders in films can be very helpful in our society if done so correctly. It can help society understand these disorders better and address them correctly if put in a situation where help is needed.